A senior consultant often manages over 100 complex surgeries a month. In the operating room, they demand the absolute edge of human precision. But the moment those surgical lights turn off, they are forced back into a chaotic, manual workflow to document what they just did. This friction creates the first of three major systemic failures: data decay. Point-of-care documentation is currently so slow and cumbersome that critical surgical nuances and procedural details are permanently forgotten by the time the doctor sits down to log them. This diagram maps the typical private practice revenue cycle. Notice how up to 15% of that income simply evaporates due to untracked invoices, unlogged procedures, and pending payments. This is revenue leakage, and it directly penalizes doctors for their high volume of work. Then comes appraisal panic. Compiling years of scattered surgical logs for annual board reviews or hospital appraisals requires days of agonizing manual data entry. Every day, these highly trained professionals generate massive amounts of valuable medical data. Yet, because of how that data is captured, they are essentially drowning in paperwork while starving for actionable insights about their own careers. To understand why this paradox exists, we have to look at the structural ownership of electronic medical records, or EMRs. EMRs are the standard digital ledgers used to track patient histories. Hospital EMRs belong exclusively to the hospital. When a doctor logs a surgery, they are essentially renting access to their own clinical experience. As surgeons move between different hospitals, they encounter entirely different, fragmented IT systems. None of these systems communicate with each other, leaving the doctor with no portable portfolio of their actual work. A doctor's career trajectory, their financial stability, and their professional growth hit a hard ceiling when they do not own the clinical data they generate. To regain control over their time and their finances, physicians must reclaim their data. They need to shift ownership away from the institution and back to themselves. This is exactly why a high-volume urologist and transplant surgeon built DocLogbook. It is a portable, physician-owned digital ecosystem designed to handle the complexity of real-world clinical practice. The first pillar of this ecosystem is the Log on the Go mobile app. It is built for lightning-fast, immediate capture right at the point of care. Doctors can instantly log details from the outpatient department, or OPD, where patients are seen without being admitted, as well as complex surgeries, imaging files, and anesthesia records. By recording this information while the surgical details are still fresh in the doctor's mind, the app completely eliminates the data decay problem. Pushing data capture directly into the physician's pocket turns chaotic, delayed memory recall into a precise, continuously updating, lifelong digital record. Data flows from the mobile app to the web portal, converting into actionable intelligence. The financial dashboard gives doctors immediate visibility into billed versus received revenue. By flagging pending payments, doctors can instantly plug that 15% private practice revenue leak. On the professional side, the portal uses this same data pool to instantly generate an appraisal-ready, perfectly formatted PDF portfolio and a dynamic CV with a single click. This model has already secured global validation. Moving from a single utility app to a comprehensive software-as-a-service platform, DocLogbook is actively scaling across more than 16 countries with over 2,000 active users. The web portal transforms a simple mobile logbook into a professional command center, actively protecting a doctor's daily income and their long-term licensing credentials. If we zoom out to the macro industry trends, medical licensing boards globally are aggressively shifting away from standard peer reviews towards strict, evidence-based appraisals. In parallel, the private practice market is becoming intensely competitive. Financial efficiency and rigorous data tracking are no longer option optimizations. They are strict requirements for survival. This scatterplot illustrates DocLogbook's Phase 2 vision, transitioning from tracking historical data to predictive, AI-driven insights. Watch this isolated data point. Algorithms will automatically compare a surgeon's specific complication rate for procedures like PCNL against the national average, proving their superior competency. In a digital-first healthcare landscape, a doctor's clinical and financial data is their absolute most valuable career asset. DocLogbook ensures that this legacy belongs entirely to the physician who built it.